So this webinar is recorded, so you'll be able to view a recording of it afterwards. And all the lines will be muted. If you have questions, please put them into the chat box, and I will facilitate asking those questions to the speaker at the end of the presentation. So today we have a webinar presented by Dr. Kelly Coleman, titled Medical Device Irritation Testing, an In Vitro Alternative. And Dr. Coleman is distinguished scientist at Medtronic, where he serves as chief toxicologist. In that role, he provides preclinical product development support across all the company's business units. This includes biocompatibility evaluation, risk assessment, and toxicology consultant. Prior to joining Medtronic, he worked as a consultant for the chemical, pharmaceutical, and medical device industries. And Dr. Coleman is a member of the ISO Technical Committee 194, which is responsible for biological evaluation of medical devices for skin irritation and sensitization. And in this role, he is actively involved in evaluating alternatives to animal testing. Dr. Coleman is also heavily involved in a number of professional societies within and including the Society of Toxicology. So the first thing I wanted to do is inform you of our next annual meeting, the third annual meeting, where chemistry and biology meet AOPs as a framework for advancing toxicology. Is going to be November 12th, and it will be in the same place as all of our previous meetings, the NIH campus in Bethesda at the Lister Hill Auditorium. And we will be accepting poster abstracts until September 5th. Right now, there isn't any information about poster abstracts or registration up on the website, but that will be forthcoming very shortly. And that website is ascctalks.org. Where our plenary lecture is going to be given by Dr. Robert Kavlock in EPA's Office of Research and Development. We'll have 2 additional plenaries to be confirmed around the topic of adverse outcome pathways, and then a panel discussion, as well as talks from submitted abstracts and a poster session, social reception. So a very similar format to previous meetings, but we hope you'll mark that on your calendars and plan to join us. So with that, I will give the floor to my speaker. And Kelly, you should be unmuted.
Okay, can you hear me?
Yep.
Just a second. All right, do you see my first slide?
I don't.
All right, I must be doing something wrong.
I think you have to accept the screen sharing.
Okay, give me a second. All right, I'm missing. Okay, I don't see the box I need to click. Your screen sharing. Just a second.
Do you see a button to show your screen?
No, hang on. Just a second. No, unfortunately, I don't see them. So should I log off and try to log in again?
Let me try taking the presentation back. Okay, so you all can see my screen. And now I'm going to give it back to you. And something should pop up that says to show your screen.
Oh yes, it says I'm ready to show my screen. So I just click on that.
Mm-hmm.
All right.
There we go.
Do you see it?
Mm-hmm.
All right. Okay, just a second. Okay, so you see the first slide?
Yes.
All right. Well, thanks. Sorry for the delay. And I'd like to thank Christy and Society for inviting me to chat today about this project I've been working on for the past couple of years. She mentioned I work for Medtronic. This is my 6th year of being a full-time employee with them. I've been a consultant for them previously, and having a good time. It's an interesting company. No shortage of work to do. So let's see here. Here's my disclaimer that the 3M, excuse me, the Medtronic legal department always asks me to present. These are my opinions, not necessarily those of Medtronic, but I don't think I'm going to say anything controversial. So take that for what it's worth. Here's an outline of what I'm going to chat about today. Medtronic's experience, a little bit about ECVAM's validated methods, questions about these models, discuss this feasibility study that we did, and a validation study that we're in the process of planning. The skin irritation test, this DRAISE test, you're probably familiar with it. It's been around for a long time. It was actually incorporated into the medical device testing world back, I believe, in the 1980s when this tripartite agreement was developed between Health Canada, FDA, and the UK. And it's been in the ISO standards, I believe, since the early 1990s, probably 1993 when they were first published. The Part 1 standard was published. In any event, it uses 3 or 4 animals. It takes a couple of weeks. It costs us anyway $1,700, and you can actually do 2 different kinds. You can do primary irritation, which is a surface application, or you can do intradermal injection, which is what we typically do because most of our devices are implanted. They're not surface devices. So this is the test in question. And as I mentioned, I worked in Medtronic for 6 years. When I first came there, I learned about a system that they have. It's called BID, cleverly named BID, the Biomaterials Information Database. And this thing is quite sophisticated and has records of all of Medtronic's biological testing going back for decades. I've seen ones to the early 1980s. There's probably ones from the 1970s buried in there also. But in any event, you can search this many different ways, by test, for example, by product number, all sorts of different ways you can look for information in there. And so I started looking for data about irritation test results and found that many of these, hundreds of these, have been done over the years, and thousands of rabbits, lots of money have been spent on this, and literally 99% of the time we always pass these tests. And I thought, there's got to be a better way of doing this. We're redoing this test, rerunning this test year after year, spending a lot of time using these animals and getting the same answer. So that's suggesting to me that it's unusual to find anything that's an irritant in a medical device, which is a good thing, obviously, for patients. But on the other hand, I think it's a waste of time and money and animals to be confirming, what we already suspect. So that was my mindset getting into this several years ago. That I thought there's got to be a better way of looking at skin irritation, which led me to the Society of Toxicology meeting in Baltimore in 2009, where I connected with a fellow named Albert Goldberg from Center for Alternatives to Animal Testing at Johns Hopkins. We went to lunch and had a good time. And I told him the story about medical devices. He wasn't too familiar with the device, and he said, "Well, well, you should come and meet my friends who work at CTAX. They're involved in cell-based testing, and they might have some ideas. So we went back to the TAX Expo, which is where all the vendors are at the SOT meeting, and met his buddies from CTAX because he was on their, actually he's on their science advisory board. That's how he knew him. But I started having some discussions with them, and we thought, maybe there's some way we could use one of these methods that have been recently validated by ECVAM for testing irritation of pure chemicals. So that's how this little project of mine got going. Going to an SOT meeting, running into some people, and launching an idea. So the primary question that we had, because I've been to ISO meetings around the world, and when I first started going to them, these are ISO TC 194 meetings that are responsible for the 10993 standards. And when I first started going to those meetings and getting up and talking about this, the standard response you typically get from people was, they'd say, well, gee, these ECVAM validated methods have been approved for pure chemicals, neat solutions, not dilute extracts like we get from medical devices. So we can't just take these, methods off the shelf that are validated for pure chemicals and just say that they're fine for medical devices. There's got to be some testing involved here to figure out if these things would even work. So that was the primary question, the primary pushback or challenge that we got from day one, talking to people about this. They were very, very skeptical. And if you look at this other, that was our primary question from people. The secondary question we got from a lot of people was, well, what's the difference between these two different endpoints? Primary irritation, as I mentioned, is a trace test where you clip the skin of these rabbits and you apply, I think it's a half a mil of solution to their skin, and then you cover it with a gauze pad and usually some saran wrap or something to hold it in place, and then you read it over time and score it. And that's done occasionally in the device industry, but probably less than 10% of the time. And the second endpoint is intradermal reactivity, where you take a very fine needle and inject it, your solution, and you inject, I believe it's 200 microliters right below the surface of the epidermis, because you're trying to simulate what might happen with something, with an implanted device. So the other question, secondary question was, well, gee, are we measuring the same endpoint with these two types of tests? And after talking to a lot of smart dermatologists and reading a lot of papers in literature, came to the conclusion that essentially we're measuring the same thing, but we're getting at it from a slightly different angle. The dosing is coming from a different route, application, apical application versus intradermal application. And here's just a picture of a cartoon from one of my favorite websites, howstuffworks.com. But I don't know if you can see my cursor. But up here, this is our epidermal layer, which is actually made up of several different layers, a basal layer and a spinous layer, granular layer. The dermis is down here, and the epidermis is composed primarily of keratinocytes, and the dermis is, well, it's got some adipocytes, but a lot of fibroblasts. And so when you do an intradermal injection, you're trying to get it in here, into this this area right in here. So let's keep moving, which led us to this feasibility study. I came up with this idea after speaking with these folks at CTAX and a lot of the senior scientists at Medtronic and some of our consultants, and we decided we were going to try to do a study, and we applied for a grant, an internal grant in Medtronic, and I was surprised because they gave me some money, which was great, because otherwise we wouldn't have been able to do this. So there are a number of steps that were involved in this. Assay selection, choosing some materials, looking for irritants, deciding about spiking versus extraction, which I'll talk about, and then doing some range finding, which is like a titration curve study, and then a main study. So assay selection, as I mentioned before, I showed you a picture. At the time, back in 2009, 2010, there were 3 assays that ECVAM had validated, and which subsequently OECD had adopted as standalone replacements for the rabbit test for pure chemicals. And these were the 2, EpiSkin, Skinethic, and EpiDerm. And we talked to a lot of different people in government labs and contract labs and thought about this. And we concluded that based on, at least at the time, based on concern about importing tissues from Europe versus getting them here in the United States, and just the ease of use of the protocols involved, that the EpiDerm assay would be the best one to work with for our validation, for our pilot project. So that's what we chose. Here's a picture, an exploded magnification version of the EpiDerm skin model from the side, and you can see up at the top, here's our dead cell layer, stratum corneum. Down here you've got basal, spinous, granular layers like you'd see in normal skin. So these things are very similar to human skin. They don't have hair, they don't have nerves, they're avascular, but they're very good at simulating the response of human tissues to a whole variety of things. And here's another picture, another cartoon of epidermal layers. And as I mentioned, you've got the dead cells on the surface, obviously, and granular layer, spinous layer, and a basal layer. And here's your dermis down here. So here's a couple pictures, one from L'Oreal and one from MatTek. These are just photographs of what happens in the lab. But over here, basically, you've got a media solution that feeds the tissues. They sit on a fritted membrane, and then you apply your test material to the apical surface. And we were applying 100 microliters, actually, instead of 200 microliters. But this is what it looks like in the lab. And here's a cartoon, and then here's an actual picture of L'Oreal's particular setup, which is actually similar. As far as the materials go, I spoke to a lot of our chemists at Medtronic who've been in this business for a long, long time, and they told me something which actually, I guess it seems pretty obvious when you think about it, but it's difficult to extract much from really hard polymers. That's what's shown up at the top of this green triangle. They told me that usually they get less than 1/10 of 1%. And by hard polymers, I mean things like PEEK or polycarbonate or polysulfone. Whereas soft polymers like silicones or soft polyurethanes, for example, or some adhesives, also down here, typically when you run extractions, and these are polar and non-polar extractions, it's usually you see 3 to 4% of something gravimetrically that you're able to extract out of these, and this is over an extraction period of a couple of days. So that was something we needed to keep in mind when we were designing this study, because we weren't sure initially, what if things that were irritants were in medical devices. They were in like a piece of silicone, for example, a medical device, a piece of tubing, for example, that you'd use to put inside someone's bloodstream. How much conceivably of this irritant could come out of it, over time? And we didn't know if it was 10% or 20% or 1/10 of 1%. So it was helpful to know this backstory, just in general, about how much you can extract from different polymers based on their durometer or their hardness. And these were the materials we ended up choosing. We picked a couple of adhesives, some silicone rubber adhesives, and then we picked some polyurethanes, polycarbonates. You can see some others here. We had a PVC, LSR, and some hard ones, polycarbonate and PEEK. So we had a wide range from soft to hard materials that we worked with. And then we were thinking about irritant chemicals. We had a finite budget and a finite amount of time, and we thought, well, what things could we use that would be strong irritants? And by strong, I mean they'd be R38 irritants, which is how the EU classifies them. So we wanted R38 irritants that had something at least tangentially to do with the medical device industry. And the two we ended up choosing were lactic acid, because that's an R38 irritant. It's used to make PLA, for example, to make resorbable polymers that are used for drug delivery and other purposes in medical implants. And we picked heptanoic acid. That's used actually to make steroids and other drugs, so it has some kind of relationship to the medical field. And also it's an R38 irritant, plus it's what's called an R34 corrosive. So that's a very, very aggressive chemical, very strong skin irritant. And skin irritation, by definition, is a reversible insult to skin. and corrosion is an irreversible insult. We didn't want to irreversibly insult our tissues, but we did want something strong, so that's why we picked heptanoic acid. Which brings me to this spiking versus extraction issue, because in the device industry, if you're familiar with it, you know that when we do these studies, we do irritation studies, we'll take typically we take the finished device if possible. If not, we'll take a portion of it and we'll bag it, tag it, sterilize it like we normally do, either with ethylene oxide or with gamma radiation, for example, and then ship that off to one of our contract labs, and then they will run polar and non-polar extractions. And by polar, I mean they would use typically saline or purified water, and non-polar, they usually use a vegetable oil like cottonseed oil or sesame oil, because you're trying to pull things out of your device that are soluble, in water and soluble in fat or oil, because you're trying to simulate what might happen if a device was implanted in a human or in an animal. Trying to simulate what would come out in blood, and then what would come out if it was implanted in muscle, for example. That's why you use these two extremes of polarity in solvents. So we're extracting physical, pieces, either whole devices or pieces of devices. And we thought, well, how could we do that with our two irritant chemicals? And it seemed to me like there was three options. And one was to find some polymer company that would sell us polymers that had been impregnated with both of those, the lactic acid and the heptanoic acid. And we quickly realized that nobody made those things because there was no market for such polymers. And the second thought we had was, well, we could try making them on our own, which is something that, we thought about doing it. It was kind of beyond the scope of what we were talking about at the time, and we were concerned about how uniform it would be and a lot of other analytical issues. So that was a second idea. And then the third idea was, let's just take some of these materials that we chose, run these standard extractions on them, and then spike the extracts, which are like dilute chicken soup, basically. Spike those extracts with small amounts of irritant, our two irritant chemicals, at levels that we know would cause an irritating response in this particular assay. So that's what we decided to do in the end. We thought the spiking option, it doesn't exactly simulate what goes on in the device industry, but it's a very good way to produce, or make a reproducible and quantifiable extract solution that we could use to test on these tissues. So spiking is what we went with, and this is how we did this extraction procedure. We started with our materials, and then we made actually 4 separate, and these ran at physiological temperatures, 37 degrees C, for 3 days, which is typical based on the ISO standards. And we used sesame oil and saline, and we made 4 different extracts in the end. And at the bottom, you see these cones, the yellow over here. This one is spiked with our lactic acid. This one is spiked with an appropriate amount of heptanoic acid, and then these are just plain. And so these are saved as controls, actually. So in a range finding study we did, this was like a titration curve you might have done in chemistry back in high school or college, but we wanted to figure out what was the EC50, and by EC50 I mean what would be the concentration of these two irritants, lactic acid and heptanoic acid, that would be required to kill half the cells in our epiderm tissues, because that's the threshold. The 50% cell viability, threshold is the cutoff for irritation. So if you kill more than 50% of the cells in this assay, then your solution, your extract coming from your device is considered to be an irritant. So EC50 was important, and we were also interested in what the NOEL was, which was, what's the concentration, highest concentration that is not going to produce any cell death. And we were able to find this out by doing this titration curve. Where you see up here, we used just different concentrations that were in this range that I talked about earlier, from down around 0 up to 4%, because we figured that was, those were the, put it this way, the goalposts on either end of the football field that we were playing on. And we in this range finding study, it was interesting because we were able to show that without a doubt, at least for these two particular irritants, that we were in this, no problem, we were in this range. So we had EC50s around 3% and around 1% for these two things. So here's just a bar graph from that shows cell viability. We did two endpoints, 24 hours and 48 hours. And I'll go left to right on here. And this is phosphate buffered saline. This is cell viability. So thankfully our saline is not killing any cells after 1 or 2 days. Tritinex 100 was our positive control. If you've ever worked in a chemistry lab, you're familiar with this one, well, Tritinex 100 because it's used as a detergent. It's a good skin irritant, not as powerful as sodium oil sulfate, but adequate for our purposes. So we were using 1% Tritinex 100 as our positive control, and you can see obviously that we only have a cell viability level here of about 10%. So our positive control was very good at killing cells. And this is just the saline that we use. This saline over here is a buffered saline, and this one is not buffered. This is the 0.9% saline vehicle. This is the sesame oil vehicle that we used. And here we see that thankfully neither of our vehicles are causing any cell death, which is good. And now here's sesame oil that has lactic acid in it. And you'll notice when we put lactic acid in sesame oil, it behaves differently than when you put it in saline. And that's because lactic acid is very soluble in water, so it's a polar molecule, and it's not so soluble in oil, which is our nonpolar solvent. And you see here, after 24 hours, with this sesame oil, lactic acid and sesame oil, we still have pretty good cell viability for about 50%, but after 48 hours, you can see more of these cells have died. Here, saline dissolves really well. Lactic acid dissolves really well in saline, and we've got very good cell death here. Obviously, with this 4% solution, we're killing about 90% of the cells. And here, heptanoic acid, same story. Heptanoic acid has a pretty high, relatively high octanol water partition coefficient, so it's more soluble in oil than in water, and that's what we're seeing here when you look at these two. Here, it's heptanoic acid is readily dissolved in the sesame oil, and we have a very high kill rate, only 10% viability of these cells. And here in saline, the heptanoic acid does not dissolve very well. It's more like salad dressing, frankly. So that's why we see a lot higher cell viability in that particular graph. And here we also did, and I forgot to mention something, this cell viability. We're measuring MTT. It's a classic quantitative cytotoxicity endpoint where you're changing a dye from yellow to purple. And I always forget the name of MTT, but it's a really long organic molecule name. But it's a classic quantifiable assay that's been used for years around the world for cytotoxicity. So MTT is what we use for cell viability. We also looked at inflammation, and we did that by looking at one of these cytokines, this classic IL-1 alpha cytokine. And here, inflammation, I guess the way I would describe it is inflammation is cells that aren't dead, but they're not happy, and so they're angry, and so they're giving off cytokines and other things like maybe, tumor necrosis factor, other things that are bleeding out of these cells because they're pissed about the situation that they're in. But if we look over here on our positive control, we just see that we have a great deal of IL-1 alpha that's being released by this Tritinex 100, which is a pretty good irritant. Here, the phosphate buffered saline, we're not seeing much. Our regular saline, we're seeing a little sesame oil, a little, not too much here, and then we're seeing more of it with the heptanoic acid. So let's keep going here. So this main study, that was our range finding study, and then this main study that we did, we used slightly higher levels. If you remember, the EC50 number, I think, was about 2.8 or 2.9% for lactic acid, so we boosted that up a little bit to make sure we had enough to kill 50%. And then heptanoic acid, I think, was around, the EC50 was around 0.9%. So also we boosted this one up a little bit to make sure that if it was going to work, that it would kill at least half the cells. And we used, as I mentioned, 100 microliters placed on the apical surface of those tissues. We decided that a 24-hour incubation was sufficient at 37 degrees. And when that's over, then they take those little discs that I showed in that cartoon in the L'Oreal picture. They wash those 25 times with this phosphate buffered saline, and then they run the MTT assay and the cytokine assay, which is an ELISA method, actually. So what do we find out from this main study? That these saline extracts that were spiked with 3.25% lactic acid significantly reduced cell viability. So we definitely had over 50% kill rate. Therefore, those solutions, those extracts, or simulated, medical device extracts were definitely skin irritants. Same story with hypnoic acid, even though it wasn't quite as dramatic, but cell viability was less than 50%. So again, these extracts were considered to be skin irritants. And interesting thing too is this down here talks about IL-1 alpha release, and it's just referring to hypnoic acid, as you saw in that previous graph. The hypnoic acid really drove off or caused those cells to give off a lot of cytokines, a lot of IL-1 alpha. Lactic acid, not so much. And we weren't really sure why that was the case. It was similar to the saline control, actually, and we wondered if it was lactic acid was having some effect on this ELISA assay, or if it was affecting the lactate dehydrogenase pathway, possibly. But in any event, for cell testing these days, or for, put it this way, in vitro irritation testing, OECD only uses one endpoint, and that's cell viability, which is the MTT assay. And they decided that the information gained from also incorporating IL-1 alpha into the protocol just wasn't worth it, time-wise or money-wise. So here I was just going to show you a couple pictures. This was AST004, cleverly named. AST is Alternative Skin Test Sample 4. And on the left side, we see cell viability. On the right side, we see IL-1 alpha release. And this was a polyurethane elastomer, ADA, so it's fairly soft. And here, if we look at the blue bars, again, we saw this before, the negative control, the buffered saline doesn't kill cells. The positive control kills cells. The vehicles don't. Here, the lactic acid and saline does a pretty good job of killing cells. And these stars mean it's statistically significant. And over here, we've got the material, the extract of this soft polymer in oil, and it's doing nothing again. And these things, and by the way, I guess I forgot to mention, all these materials that we chose, they've been used for years throughout the device industry. It's nothing unique to Medtronic. You can get on Google and buy them right now if you wanted to. So these things are well known and used for decades, and they're not irritants. They've all been passed the rabbit test, and they've been used for many, many different applications. So this is what we would expect to see when you do extractions with oil or with saline of things that are known not to be irritants. And this last bar, though, is just that same extract that's been spiked with some of this heptanoic acid. And here it was also shown to be an irritant. So both these, in both cases, with this particular solution, there was no problem to prove it was an irritant. And then here's another one. This is a peak polyether ether ketone. This is a very hard polymer, and we see similar sorts of things happening here. So what do we learn from all this? That at least based on the conditions that we tested our extracts under, that these epiderm tissues were able to consistently detect very low levels of these two R38 irritants in these dilute solutions. And MTT was the best predictor. IL-1 alpha is of some value. Maybe you could use it as a tiebreaker if things are really close, but in general, we didn't think that it was worth the time and expense, because ELISA kits are kind of expensive. And the thing I think I need to stress here is that the thing up front, when we talked to people about this, and as I mentioned, they were concerned about these assays have been validated for pure chemicals. How on earth could they also, or would they be able to detect really low levels of irritants in medical device extracts, which are complicated solutions? I mean, they're dilute solutions, medical device extracts are, but we run these extractions all the time, and we shoot the extracts through very fancy gas chromatograph mass spectrometers and liquid chromatography mass spectrometers, and find many, many peaks. And so you see all sorts of different things that show up in medical device extracts. And the things that appear, sometimes there are monomers, there are oligomers, there's mold release agents, there's colorants, there's anti-static agents, there's all kinds of stuff. So it's a dilute solution, but it looks like when you look at the peaks, it's a real forest. And the concern expressed by a lot of people, by the skeptics years ago, was that these tissues might be great, for detecting strong irritants that when they're pure solutions, when they're neat solutions, but are they smart enough to sniff out very low levels of irritants that are at the same concentrations as all this other stuff that comes out of the medical devices when you extract it. So that was the real key question. I think I mentioned that earlier, primary question, and we're able to show that they did. They were able to sniff it out, at least for these two at this point. So that was our feasibility study. So this work, we put this together and wrote it up, got it published in Tox in Vitro. I know, I think your organization has a deal with Elsevier on that journal. You want to get the abstract, and say just get on to PubMed and type in my last name and then KP, or my initials, and it'll pop up. And you can read all about it if you're interested. So what's next? I presented our results to ISO TC 194 Working Group 8, which is responsible for the Part 10 ISO 10. It gets confusing. It's the Part 10 ISO 10993-10 standard. So I'm not sure why years ago ISO decided that the numbers of the working groups would not match the numbers of the standards that they're responsible for, which is unfortunate because it gets confusing. But in any event, Working Group 8 is responsible for the Part 10 ISO standard, and the Part 10 standard is concerned with irritation and sensitization. So I presented this a year and a half or so ago to ISO Working Group number 8, and they thought it was interesting, and they thought, we should try to validate these results. We should run a round-robin study and see if we can confirm your findings. And if so, then we should talk to ECVAM about this and see if they will buy into what we're doing, and then change the standards so that in vitro testing for irritation would be the preferred method instead of the rabbit method. So to do that, we talked to many of the members of this working group, and now we've got, believe it or not, 16 labs that are from different medical device companies, contract research labs, a couple of universities, and some government labs that are interested in participating in this round robin. So we've got plenty of labs, frankly, that are interested. And MatTek, who provides this tissue, is also selling us the tissue, but they're also providing free training for these labs on this protocol that we've developed. And we thought that what we would do to try to make this a little bit more of a real-world validation study would be to actually create some positive polymers and then also run some spiked extracts like we did before. So that thing is ongoing. Here's a little outline of what we're planning to do. Protocol, plan, irritants, all this stuff. I'm just going to touch on some of these things here quickly. So now, fast forward from 2009 to today, now there's actually 4 in vitro skin assays that have been validated by ECVAM. The last one, LabSite, comes from Japan. And all 4 of these now have been adopted by OECD. And if you look at the OECD 439 guidance document on in vitro irritation testing, you'll see these, all 4 of these are listed in there and described. So once again, we decided to stick with EpiDerm for what we're going to do, because it's been validated several times, successfully validated several times for different sample sets of pure irritants. So it's very good at detecting irritants across the chemical space, which was important to us. And some people had approached us and said, well, why don't you include some of these other assays back here? And we debated that, thought about it, and we concluded, well, this is going to be hard enough the way it is. If we include 1 or 2 other assays, it's going to increase the complexity of what we're doing dramatically, and increase the price, and also increase the chance for error. So that's why we decided to stick with the EpiDerm assay because, as I mentioned, ECMAM says that these 4 assays now are essentially equivalent, and OECD has agreed with them and adopted all of them and saying any one of these is adequate as a standalone replacement for pure chemical irritation testing. So our reasoning was, well, if we can prove it for one of them, it'll be good for all of them. So that was the logic behind this. And we're not trying to basically rerun a huge validation study with dozens of chemicals because those have already been done. As I mentioned, we're just trying to repurpose this tissue for medical devices. So we put together a protocol last year. We call it our training protocol that they've actually been using in these training sessions, and we're going to have to modify it slightly for the actual round robin, but that shouldn't take very much time, a couple of days at the max. And it's a typical protocol that you would see for lab work. It explains what the assay is, how you run it, how you track data, everything and anything you might want to know about how to do this particular work. So MatTek, as I mentioned, is our supplier, the maker and supplier of EpiDerm, which I think has been on the market for 20 years now. And they've been great. They went and confirmed the results of our little feasibility study. They got the same answers we did, almost exactly the same, which was reassuring. And they've been testing different polymer samples we've come up with and other samples, some other medical samples we've come across. And they've also are providing free training for these labs, and they're giving us a discount on the price of the tissues, which is helpful. Our current plan, we've been talking about testing, well, maybe 8 or 10 samples. It'll be a combination of positive and negative materials. These are all going to be blinded, obviously, when they're sent out to the labs. And we'll have positive and negative controls and vehicle controls. And as I mentioned, we're going to use some positive polymers and some spiked extracts. Positive polymers, we've been making or are making polyurethanes with lactic acid in them, silicone with heptanoic acid in it, silicone with sodium lauryl sulfate, and we have another PVC that we came across in Japan recently that we're not sure. We know it's a skin irritant, but we're not sure exactly what it is, and the company that makes it has given us permission to use it as a positive control. So that's being tested at MatTek right now, and it's also our chemists are also doing some extractions on it, and they'll be running some analytical chemistry testing on those extracts in the near future because we want to find out exactly what the chemical is in this PVC that's an irritant. And here's an example of how we've been making these things. These are actually hard Teflon blocks. So it's this white Teflon, the kind if you work in a lab or if you're a plumber, if you get this Teflon tape and wrap it around pipes to seal them, it's the same kind of Teflon, but this is really, really hard, and these are milled out, and they're kind of difficult to see probably, but they're different wells in the top of these of different depths, and we use the shallowest ones, and I think these are, they're about a ½ inch by maybe 1.5 inches, and maybe 3/16 of an inch thick. And so we fill these, we mix up solutions, and it's almost like a shake and bake routine of these different polymers we've been working with, and these are actually cured at room temperature. They're not heat cured thermoset polymers, which is good because that was one of our fears initially, that if you had hot curing polymers, it could probably destroy or might potentially destroy your irritant chemicals. So that hasn't been an issue with these, and we've run a lot of tests on these to essentially range finding studies to figure out how much do you have to put in to a polymer in order to get out enough when you run an extraction on it to get out enough to fail this test. And the take-home message from all that work is pretty simple, and the message is you have to put an awful lot of irritant into a polyurethane or into a silicone in order to extract out enough to fail this test. And by loading them up with a lot, I mean like 20 to 40% by weight. So if you can imagine, if you were a medical device maker, why on earth would you buy silicone in tubes or buy in beads and then make up a material that you're going to use for a device and add by weight 20 to 40% of a known irritant to it? That just doesn't make any sense, obviously. And that's another reason why when for years and years Medtronic and many other medical device companies and contract labs have been running rapid irritation tests, it's very rare that you see anything fail because it's hard to extract stuff from materials, just number one. And number two, it's, why would anyone impregnate polymers or adhesives with things that are known irritants? So that was the surprising thing to us when we did this, that you really have to load up these polymers with a great deal of irritant chemical in order to be able to back extract enough out to fail that test. So irritants, as I mentioned, lactic acid, heptanoic acid, SLS, and then then there's this mystery one that's in the PVC, and then we're thinking about a couple others that we might include that are device related. Okay, what else are we doing? And as part of this validation study, we're also going to do rabbit tests. And these are intradermal, just extractions on our polymers. And if we're just take that back, we're going to do the positive polymers. We're going to have them, when NAMS is going to do this, run extractions on them. And then for things that were irritants that were just spiking into other extract solutions, we're going to have them inject those also, because we just want to see how rabbits react to these low levels that are producing, irritation responses in the epiderm tissue. So that's another data point that we wanted. Rabbit testing on dilute concentrations of irritants. And we're also going to do human patch testing with some volunteers in Europe, and MatTek is going to coordinate this. Same story. These are going to be primary irritation, though. They won't be injected. They're just going to be skin patch tests on the forearms of a couple dozen volunteers with these same irritant chemicals at low levels, because we just want to see how humans react and then compare that to the results that we're getting from the epiderm tissues. With the help of Nelson Labs, we're going to be working with Sebastian Hoffman, who's a real terrific biostatistician. He's been involved with this in vitro validation work for many, many years, and is quite familiar with all of it and with all the players at ICBAN. And we just feel lucky that he's agreed to help us, and we're grateful to Nelson Labs for offering to help cover his fees. So what else? Proficiency testing is something that we were going to have the validation labs involved in. They're going to come and take this training, and then we're going to send them some samples, some blinded samples, and just ask them to tell us, are they or aren't they irritants, just to prove that they learned something in their training. And we've got to pick out a few more chemicals, as I mentioned, and deal with preparing enough samples and shipping them to the labs. So as I mentioned, there's a few labs that are going to still remain to be trained. NAMS is going to do this rabbit testing. MatTek's going to coordinate this human patch testing. Medtronic's going to be responsible for making up the polymers, and Nelson Labs has volunteered to coordinate the shipping, which is also wonderful. So this summer, this is our optimistic timeline, some people might say, but we're working on the polymers. In August, we hope to get these other skin tests done, get the samples prepped in the fall, and get this thing started. Because once you start this, it goes pretty fast, and the hard part will be writing it up and writing a report. The lab work shouldn't be that difficult for the labs if they've taken the training and are familiar with the protocol. So next steps: complete this validation study over the next year, publish the results, hope it works. If it works, we're going to talk to ECVAM and see if we can get their blessing. That's ECVAM Science Advisory Committee, and the eventual goal is to change the Part 10 standard, as I mentioned, to say that the new normative method for doing irritation would be in vitro testing, and rabbit testing would be relegated to the appendix, which would be called informative. Just say this is the way we used to do things. At least that's our dream scenario. I wanted to thank these folks, Elena Kandarova and MatTek, and beyond in the Netherlands, Lisa Blakeman, Jim Wallaby, and James McKim of CTAX, which is now called Ciprotex, and Lori McNamara and Tom Grayler from Medtronic's Analytical and Polymer Labs. And I wanted to thank the Medtronic Quest Committee for believing in us and giving us some money to fund this work. So thanks for your time. I'd be happy to answer any questions if you've got some.
Well, thanks, Dr. Coleman, for that presentation. That was really nice to hear, and I hope our attendees. I know I learned a lot. I love practical presentations, where you kind of have gone through all of the challenges that you face and some of the considerations, and hopefully people who are listening will be able to think about what they can do with other endpoints that they're dealing with in their materials assessment. So we have one question on the chat. And again, if you have other questions, please type it into the little chat. And it's how important, it comes from Malcolm Wilkinson, and he's asking how important might it be to extend tests for longer than 48 hours, given the potential long-term exposure likely to be seen for implanted devices?
Really good question. We're getting some feedback here. We've debated that particular question, and MatTek has run some of these longer term time points, as you mentioned, and came to the conclusion that for what we're doing, 24 or 48 are still the optimal. And this particular assay, it's called the, I'm trying to think of it now offhand, they've got, was a cosmetics industry protocol they developed specifically for dilute solutions of things for cosmetics ingredients for this EpiDerm assay. And that was optimized at 24 hours based on a lot of different work that went on for many, many years. And we asked them, and a lot of people asked us this at those ISO meetings too, why don't you do this, why don't you run this for 72 hours, why don't you run it for 96 hours? And there's a point of diminishing returns from what I've been told, and there's an issue with just cell viability also over time. Those cells last for a couple of weeks, but usually after, 4 or 5 days, they really peter out. And so the reliability of the data as the cells start to die drops off. So that's about all I guess I can tell you about it. If you're interested, I could get you a copy of that EpiDerm protocol for cosmetics that we've modified, actually. Send me an email. I'd be happy to email that to you.
So just if you're wondering how to contact Dr. Coleman, when I sent out the invitation, he was copied on the invitation for the webinar, so you would see his email there, or you can contact me, ksullivan@pcrm.org. I've got another question from Dr. Garside. John Garside, was the possibility of testing with direct exposure to the solid plastic considered? I understood that OECD 439 standard protocol covers solid materials. Might that not be an easier route with the FDA? And I assume that means with approval.
Yeah, that's a good question. It's something we didn't do with our initial feasibility study because we didn't have any polymers. But we've got a call coming up in a couple of weeks with our I don't know what you call it, the task force that's working on this validation study, and that's actually something that's on my short list I was going to talk to them about, because I know solid materials are an issue, and other people have asked us that, so it's going to be an agenda item, and stay tuned. I'll get back to you about that.
Okay, great. We're getting some chat that's saying thank you for the great presentation, so that's good. I am going to go ahead and unmute everyone just really quickly to see if there are, perhaps people that are having trouble with the chat, just for a second, and I'll warn you, it could be a lot of background noise, but everyone go ahead and speak up if there are any questions. Nope. Okay, great. Well, thanks again, Kelly, and this was great, and I would encourage anyone to get in touch with me if they have additional questions. Um, and um, thanks again. And hopefully maybe we can have you back on when you finish the validation study to present the
Sure,
results.
sure. Well, thanks for your attention. It was fun.
Okay, have a great day, everyone.